Alright, I want everybody to picture a rubber band. Just a normal, stretchy, works great, out of the package rubber band. I want everybody to now picture back in that old drawer that everybody has in their house, the junk drawer where all that random stuff and nobody knows what it goes to, but it's definitely important where all that stuff goes. You know, in the back there's probably a rubber band that's been there for 5 or 10 years. Think about that one. When you stretch the normal rubber band, pulls, stretches just like it's supposed to. It works great. Now picture that old rubber band that's kind of sat there for a while, hasn't been stretched out. Go to pull that one, a lot of resistance, and if you pull too hard too quickly, snaps. Just like that. Really quick. This is a great analogy for a hamstring strain. Normal hamstrings have lots of stretch, able to work with that weight that's put on it. Hamstrings that are tight and aren't used to being pushed all the way to their full potential, you know, you take off wrong one time and you got a hamstring strain. So it's really important to know how to prevent hamstring strains before they happen and to know how to prevent re-injury or worsening of the current injury so that they don't get worse, because hamstring strains get worse the more there are. The most common definition is with a hamstring strain, the muscle fibers become disruptive and there's pain due to the micro tearing of the hamstring. Generally, the most common hamstring to be strained is the biceps femoris. So these muscle fibers tighten with inactivity, and then as soon as the athlete pushes off to run, jump, kick, etc., there is some tearing that's suffered by the athlete, or a complete rupture in worst case scenario. So the mechanism of injury is different for each athlete. Running, jumping, kicking, tackling, cutting, any of these mechanisms could be the motion that causes a hamstring strain. It's different for every athlete. More than half of all hamstring strains do take place during the preseason, though. Most athletes come in not ready to play, not in shape, probably a little bit dehydrated. It's hot outside. They've been at the pool, at the beach, doing who knows what. So most of the hamstring strains do take place during preseason or within the first 1 or 2 games. So, like I said, and the mechanism is different for each player, but in football, the offensive players are more likely to get injured. So position may have an impact on the strain that takes place. Common risk factors that are seen in football players include previous injury, strength imbalances, flexibility, or lack thereof, and fatigue. So you'll see it, you know, the kids are running suicide or running shuffles, and all of a sudden somebody goes down. There are 10 minutes left of practice, but he's tired, not doing what he or she is supposed to be doing, not working on their form, and their hamstrings suffer. There are 3 degrees of muscle strains, but in regards to hamstring strains, the first degree is mild, some pain, and some loss of function because of that micro tearing, or minor microscopic tearing that takes place within the muscle fibers. A moderate or grade 2 hamstring strain includes more severe tears in the muscle fibers, as well as an increased loss in function and increased level of pain. So it's definitely going to be a longer rehab for that patient. A grade 3 hamstring strain is a full rupture of the hamstring. Imaging can be taken to determine how severe this is, but manual muscle testing, special testing, and range of motion is generally easier to use for a clinician, and especially for patients who don't want to have to go to the hospital to get imaging done. If you can rule out that it's not a rupture of the hamstring, that's far easier than sending an athlete in to get imaging when it's not 100% necessary. The severity of each hamstring strain allows the clinician to understand how intense the rehab needs to be and how long the athlete's going to be out of practice and out of play. And this also goes back to the determination of each patient. Each patient has a different level of want to be in the game. And a lot of this rehab is going to rely on their determination to get back in there. Normally, rehab programs focus on the flexibility and strength of the hamstring muscles, but it's been found that rather than just focusing on these in isolation, it's better to look at a combination of trunk stabilizers, the hamstrings, and focus on bettering agility so that there are more successful results and the player's more capable of returning to play. They're ready for more, they're better than when they left. And that's the goal of the rehab. Ice and NSAIDs are often used as soon as the injury takes place to prevent the inflammation that the body wants to go through. It's going to want to get inflamed, it's going to want to swell, and bruising is or ecchymosis is common, edema is common. So getting that ice and compression on there super fast and getting some ibuprofen in the system will ultimately benefit the rehab protocol. And it's been found in the past that performance is significantly reduced after returning to play for many hamstring strains. So because of this, functional testing is very important for the return to play. The functional testing will determine the athlete's ability to return to play and where they stand as far as if they are capable to do everything that they were able to do before, and preferably if they're better off than they were before. So the functional testing needs to include all of the actions that are required for the athlete's sport. So running, jumping, cutting, shuffling, side steps, tackling, any of these things, the athlete needs to be able to perform these without any pain, without any weakness in order to return to play. During the functional testing, the athlete needs to be pushed all the way to fatigue to determine whether they're actually ready to return to play. Because most injuries do happen during that fourth quarter, 2 minutes left to go, got to give it their all. While rehab is great, it's far easier to prevent an injury from taking place than rehabbing one after it occurs. Stretching is the best thing to do for hamstrings. Everybody's seen Ian, he's kind of at a risk for having a hamstring strain. He's known this forever. So we could probably get him on one of the prevention protocols. There are plenty of prevention protocols out there to have athletes stretch, and this can be implemented as a team activity. Throw it in before every practice, and this will get the athletes more prepared for what they're doing and prevent the likelihood of suffering from a hamstring strain. So overall, the most common mechanism of injury is most commonly it's running, but it's different for each athlete. Rehab, because of the mechanism is different, the rehab for each patient will be different. So the protocols need to adjust for each patient. Prevention protocols are best utilized during the preseason for football players and for most athletes. And implementing these will prevent the amount of time that athletes have to spend doing rehab. And an important thing to remember is that hamstring strains become more difficult to treat each time one takes place because of the increase in severity, and more muscle fibers are disturbed each time. And each hamstring strain is complex and no two are alike, so each rehab protocol needs to be adjustable.